Welcome to Health Facts with Normani Ricks. I am your host, Normani Ricks. I like to start off each episode with a little known health fact. Did you know that there is a connection between oral health and overall health? Poor oral hygiene can lead to various health problems, including heart disease, diabetes, pregnancy complications, and respiratory issues. I have the honor of having Dr. Shermnae Jones with us on the show today. She is a former dentist with over 16 years of experience, and she has treated thousands of patients and led dental teams over the course of her career. Through her work, she developed a deep understanding of the connection between oral health and physical health. She now uses her expertise to educate and empower others to make a proactive, informed approach to their health. Welcome to the show.
Hi, thank you for having me.
Thank you. So, in over the course of your career, would you say is the most alarming thing that you've seen in your work in dentistry?
Hmm, that is an excellent question. There is so much. A lot of times I see people that don't truly understand the mouth is not separate from the body.
Okay.
And the things that go on in the mouth can interfere with everything else. People that have, you develop periodontal disease, but that also contributes to heart disease. It can contribute to stroke risk, diabetes complications, pregnancy complications, stroke risk. It's more than just teeth. Most people don't realize the mouth is the portal to the rest of the body. Like that's literally the entry point.
Mm.
So it's very important, and a lot of illnesses, a lot of habits, there's a lot that your dentist can tell about you just from looking in your mouth that your physician may not notice.
Okay. That's interesting. So I know that a lot of infections can start in the mouth and then it can go like into your body and maybe like you can have like a heart infection, a lung infection. That sounds really crazy.
Yes, there's a lot of things because the bacteria, they all work on that same pathway. So, and it's all connected to your heart. And then, of course, where's your mouth? Your mouth is in your head. What's in your head? Your brain's here, your heart is right underneath.
Mhm.
So that bacteria, because it's a very aggressive bacteria, one, it's different types of bacteria. You always have bacteria, right? You're never going to get rid of it. The whole purpose of why we say, oh, brush and floss is not to get rid of bacteria. It is to remove the food particles that are in your mouth that the bad bacteria thrive on. So it's to give them less substance to eat and consume, because when the bacteria is there, the bad bacteria, you want the good bacteria, okay? You don't want to kill it all. You want the good stuff.
Okay.
But the bad stuff, it's going to eat on that sugary substances, like all of that stuff, and then it's going to secrete acid. And that's what's going to create cavities. That's what erode your bone, all of that. So that is why, oh, brush and floss, but well, that's the reason for it, is because you want to reduce having those bacteria having access. And so, even more so than brushing, and that's another thing. People think it's just brushing and flossing. No, it's all your habits. You
Mm.
don't want to have frequent exposure to like sugary drinks, soda, sweet tea, our coffee drinks that we just happen to love, the energy drinks. You don't want to have that, sip on that all day, because you're putting that in your mouth all day long.
Okay.
So you're increasing the exposure time that the bacteria have to this, which is increasing your risk.
So I have a question. So for new moms, when you're trying to practice oral health on your baby, like when do you start performing oral health and how do you do that?
Oh, very simple. So, and I'm not just talking, because of course I have a daughter myself.
Okay.
So I tell parents, start immediately. Even when you're breastfeeding, you can get a cloth and wipe their gums and their tongue. And it's more so, especially if they're breastfed, it's not to prevent cavities. That's not the thing. You want to go ahead, get them used to it, get them in the habit of having someone in their mouth, having something wiping that off. And then as they get older, and typically we start introducing them to foods around 6 months. So even if, per se, if this is a strictly breastfed baby, but you start introducing foods, at that point, that is when the saliva composition starts to change. So that's when that bad bacteria starts ramping up.
Okay.
So you want to go ahead and start introducing that, and then getting like the little finger brushes are fine when they start getting their two little teeth down at the bottom. Using the finger brush is fine, or even if you want to use their regular baby type toothbrush, that's fine too. Go ahead and start doing those things because it becomes important. Because the last thing you want is for your baby to be 1 or 2 years old and then their teeth are starting to rot because we haven't been taking care of them.
Okay. So I know in my practice as a pediatric occupational therapist, I used to see people give their children bottles with chocolate milk in 'em. And I don't think people do that too much anymore because they've learned of the horrible things
Oh,
that
no, they do.
happen.
They do.
Okay. Okay. You've seen that before?
Chocolate milk, Gatorade,
Okay.
Mountain Dew.
Okay.
No child needs Mountain Dew.
Okay.
Mountain Dew is, and of all the sodas, Mountain Dew has a very high sugar and a very high acidic content. They don't need these things. So what we're doing is we're setting them up for bad habits. It's even more than the teeth. They don't need all this sugar in their bloodstream because this is causing issues with attentiveness and attention span. Their health is suffering because they're getting too much sugar. We already have too much sugar in our foods as it is. So you're introducing these babies to this stuff so early, and our brains are wired to prefer sweet. So if you're introducing all this sweet, they're going to start craving it. Their neural pathways are going to form to start craving this sugar. So then when you try to give them vegetables and things like that, they're going to be averse to it because they're used to the sweet. So even when parents are starting their children on the baby food, I tell them do not even give them the fruit. Start with the vegetables first. Get them used to the vegetables for a month or two, then introduce the fruit because then they've developed their taste for the vegetables. So the sweet, when it comes, it's like, okay, yeah, this is sweet, but I still eat these foods too. And also, when we're doing that, putting all of the sugary stuff in the bottles, we are actually teaching them to self soothe with food. And that
Okay.
goes the same for giving them bottles at night. Usually, about after age 1, there's no need for nighttime feeding. It's a comfort thing.
Okay.
So akin to us, that would be like us going to have that bowl of ice cream at night. There's no nutritional value in that whatsoever. We're
No.
doing it because we want it.
Yeah.
Okay. And I'm saying that I'm not innocent myself. I'm guilty too. So, but that is what that is setting them up for. And you don't want to do that. They cannot miss what they've never had. So if you only give them water and milk and things like that, and you don't give them the soda, the juice, the sweet tea, the Gatorades, they're not going to miss it. They don't know what it's like. So they're not going to miss it.
Okay. So I have another question. So dentists usually recommend brush twice a day
Mhm.
and floss daily. How long should you brush for?
So, can I give you a fun fact?
Yes.
Most adults actually do not brush long enough. The average adult brushes their teeth for 28 seconds.
Okay.
You are supposed to brush for 2 minutes.
Oh, see? Fun fact.
Two
Did not
minutes.
know that. Okay.
So what we typically do, what every dentist does is and if when you go to the dentist, you'll probably hear them speak in quadrants. We break the mouth into 4 quadrants.
Okay.
And it's down the center and across this way. So this is a quadrant, this is a quadrant, this one, this one. You should spend 30 seconds minimum in each one. You can always do more,
Okay.
but you want to spend at least 30 seconds in each section. I love electric toothbrushes. I get that question a lot. Electric, regular. I love electric toothbrushes because it takes some of the work out of your hands. So it does some of it for you. So you're not having to be as mechanically inclined. And especially for people that have disabilities, joint issues, they can't, grasp it. They're perfect. I love them. Regular string floss is best. It's the best.
Okay.
And you should go down. And a lot of people, they go down, come out. No. Go in, go around each tooth, come out. Change the piece of floss that you're using, wrap it around your finger and do the same thing. Keep going around until you get the whole mouth done. Another thing is I get a lot of patients that use hard and medium toothbrushes. No, your gums do not like that. And what happens is they're too rough. They're very abrasive. And so it starts causing your gums to recede.
Mhm.
So I usually get, well, but I don't feel like my teeth are I promise you, your teeth are getting clean with a soft bristle brush. And
Mhm.
your gums are also thanking you because what'll happen is your gums start receding. Number one, you're exposing the root surface of your tooth, which is way more sensitive
Okay.
and very much more prone to getting decay, which means you would possibly have to lose those teeth. And it's usually these teeth. And who wants to go around missing these teeth?
In the front.
Correct. And then
Uh-huh.
also it's exposing the bone, which ends up causing bone loss, which causes your teeth to get loose and then they come out.
Okay. Another question that I have is, do you or don't you recommend chewing gum?
So gum chewing is tricky. I don't like the sugared gum
Okay.
because it's number one, it's sugary. Number two, it's sticky.
Mhm.
Anything that's sticky and sugary, that's a recipe for disaster. That is headed towards cavities. Not saying that you're necessarily going to get them, but it increases your risk.
Okay.
I choose sugar-free gum myself. I'm okay with it. And in some circumstances, it is advised if you suffer from dry mouth and you
Okay.
choose sugar-free gum, it helps your saliva production. So my thing is sugar-free,
Okay.
not the sugar, and you'll be okay.
Okay. Okay. So I think people paid more attention to diseases that had to do with the mouth, the throat, and all that stuff when tobacco was big, right? So now
Yeah.
that chewing tobacco is not such a big thing, like what is the number one thing that people should stay away from or that causes cancer?
Oh my goodness. There is so much. You ready?
Okay. Hmm.
People focus, in my opinion, on the wrong things. They're
Okay.
constantly focused, oh, tobacco, tobacco. Well, it's not just tobacco.
Okay.
So we've got the biggest thing. Okay, yeah, we'll talk about tobacco a little bit. Smoking overall.
Mhm.
Tobacco products reduce the blood flow to your gums. That means there's less oxygen and fewer nutrients reaching those tissues.
Okay.
So that's going to cause issues, of course, with your healing. Now, vaping, people love to vape.
Oh yeah.
Now, it doesn't have that initial combustion like traditional cigarettes,
Mhm.
but we're still seeing similar signs related to gum inflammation, the changes that are in the oral bacteria that's in your mouth,
Okay.
causing issues with dry mouth and the same issues with delayed healing. So they're looking into it, they're doing research on it. So nothing is completely definitive. However, they're in the same family. So they're going to do similar things.
Okay.
And the reason that having a dry mouth is so bad is because if you're not producing enough saliva, you're not washing away that bacteria or that food. So that's just compounding in your mouth. And I can always tell when a patient does not drink enough water, when they're
Okay.
dehydrated, because I'm in the mouth and this is kind of I'm just this type of person, okay? So I'm just gonna go ahead and throw it out there.
Okay.
But if I'm in your mouth and I try to take my instrument out and your saliva is pulling like pizza cheese, you need to drink more water.
Oh wow.
Your
Okay.
saliva should not be pulling like that. You're dehydrated.
Okay.
Vaping, smoking cigarettes,
Okay.
all of that causes that dry mouth and it's also a cancer risk.
Okay.
Especially, we know, smoking tobacco, but with vaping, what is in this stuff? Do you know all the chemicals that's in the stuff that they're vaping? And then think about they're coming out with 50, 11 flavors
Mhm.
and colors and seasonings. We don't know what this stuff. We don't know what it is, but what's in it.
Mhm.
So you have to be careful about that. The other thing I get a lot, I actually just got this from a patient this week because I'm covering for a friend and I told her, I love you because you know I don't do big people. But, oh, I don't smoke cigarettes. I smoke the plant-based substance. I'll put it
Okay.
that.
Okay.
Yes, about that. Natural and safe are not synonymous.
Okay.
Okay, I get that it's natural, it grows in the wild, but so does arsenic and
Mm.
so does poison ivy.
Mm.
But that doesn't mean that I want it in my body.
Yes.
And it also causes issues with healing
Mm.
and because it causes the constriction of the blood vessels. So if the blood vessels are constricting, oxygen is not flowing. And so this is what I tell people, even if you're any kind of smoker, it's all the same principle. So when you're talking to me about things, yeah, I want to get an implant and I want to get you are absolutely not a candidate for getting implants. Implants will fail. It doesn't matter if you're smoking cigarettes, vaping, or plant based substances. They're
Okay.
going to fail because the mechanism is the same.
Okay. What about people that smoke hookah?
It's that to me is on the same lines with vaping. Again, you don't know what's in it.
Mm-hmm. Okay.
So I wouldn't, yeah, I just tell people try to just stay away.
Okay.
And if you can't stay away, because I'm a realist, reduce how much you do it. Don't do it every way. Don't do it every day. Okay. That's because it's not worth it in the long run to, for the inflammatory issues that it causes. And also it is important for you to let us know if you, especially if you're a cannabis smoker.
Okay.
And it's not so we can judge you, but the thing about it is it's going to have an impact even on you being able to get numb for our procedure that we have to do.
Wow. I'm sure people don't know that.
Right, because they'll be like, "Well, I don't smoke, I just do this." But then I'm injecting you and I've given you 3 and 4 carpules and all we're doing is working on 2 teeth. And I'm like, "Why is this not working?" And then you tell me that well, that's why it's not working because your blood vessels are constricted and the stuff is not flowing. So
Okay.
it's going to take more. And that's assuming that you get numb because sometimes you may not. And then we have to wrap it up and have you come back on another day.
Okay. So let me ask you about fluoride.
Yes,
So that's a hot topic.
it is.
So is fluoride in water good or bad?
Let me tell you about fluoride.
Okay.
I am pro fluoride all day. And
Okay.
I'm going to tell you from a research based standpoint why. So prior to lots and lots and lots of cavities. So then they started putting fluoride in the water because they noticed that fluoride helps to rebuild the tooth enamel.
Hmm.
Cavities started going down.
Hmm.
Now we're seeing an increase in cavities because everybody wants to be anti fluoride.
Okay.
So they're not drinking the water, they're not, or they're drinking bottled water, and bottled water typically doesn't have it in there unless it specifically says fluoride is added.
Okay.
And it's so interesting to me that these are people that will, oh my God, fluoride is bad, but you got a can of Coke in your hand.
Oh.
Coca-Cola will take the rust off of your car battery, and you're willingly drinking this.
Hmm.
But you're fussing about the fluoride, and the fluoride is actually what helps. And yeah, okay, well, I heard it's a neurotoxin. Yes, it's the dosage amount. Water in excess can also cause problems too. The issue is most people are not consuming anywhere near enough to cause those kinds of problems.
Okay.
So, I tell people I never push people if they opt out of it. And I do have patients that do say, no fluoride. I don't want it. I don't want it on my kids. Okay, that's fine. I don't, I don't ever push it. But if I'm asked, I do it. I use it on myself. And that ties into another thing I wanted to mention that most people don't know is they're actually, when they use their toothpaste,
Mm.
the fluoride toothpaste, you use your brush, and rinse it. You're not supposed to rinse.
Oh.
Because when you rinse after you're brushing, you're literally rinsing the fluoride and all the protections off your teeth.
Okay.
So you should actually spit out the excess, but leave it in there. Don't rinse.
Wow. Well, you have been a wealth of knowledge. I hope that everybody that listens to this can gain some good insight and help themselves and help their family members and help their children. So, thank you so much, Dr. Jones, for coming on the show. Is there any words of wisdom that you want to leave for the listeners?
Well, I will say definitely that because I get this a lot from adults.
Okay.
Gum disease runs in my family. No, it does not. Bad habits run in your family.
Okay.
Just because grandma, mama, auntie, daddy has periodontal disease does not mean that is a sentence for you.
Okay.
All you have to do is just do the proper things, take care of your teeth, brush and floss. Like brushing and flossing will save you thousands. It's so simple, but people are so adverse to doing it.
Mhm.
But it literally will save you thousands of dollars and a lot of time and stress. And also, the thing I get when I do see patients and I'm telling them they have this and this, and they're like, oh, but it doesn't hurt. By the time something hurts, it might be too late.
Oh,
So
wow.
go for your preventive checkup. So that way, if there is a problem, we can catch it early while you still have a multitude of options. Because once we get to pain or you're coming to me swollen, and I've had people that I've had to send to the ER, adults and children, because they've come to me and their eye is swollen shut. They're like this with a big lump on their face. At that point, there's nothing I can do for you except send you to the emergency room. So don't wait for something to hurt.
Okay.
Make sure you go regularly.
Okay, great.
And
Thank you
also,
so much.
don't
Yes.
just do what your insurance pays
Oh,
for, because your insurance does not have your best interest in mind. I know you know this as an occupational therapist.
mhm.
They do not have what's best for you in mind. So you have to do what's best for you. So follow your doctor's recommendations.
Awesome, awesome, awesome. Thank you so much.
Thank you for having me.